Australia ranks 6th out of 31 OECD countries when it comes to spending on dental care. But the latest analysis from the Australian Dental Journal also shows Australia has fallen to 23rd place for public funding of dental care. In fact, the majority of dental spending comes from individual out-of-pocket expenses, meaning a trip to the dentist is a luxury that many people can't afford. Peter Braden is Health Programme Director at the Grattan Institute, and he joins me now. Peter, thank you so much for your patience. I know you've been waiting a little while.
No problem.
So where does the government money go then, if not to help more people afford to go to the dentist?
Well, when Medicare was set up around 50 years ago now, dental was just left out. And so the governments do spend money on dental care, but a lot of that money goes on rebates for people who have private health insurance, on narrow and targeted schemes for very disadvantaged children, and on some public clinics that do exist that the states and territories run. But this is really unlike other parts of Medicare. It's a patchwork system, and so many people fall through the gap. And that's why fees are so high, and we see over 2 million Australians saying they are delaying or skipping dental care altogether because it's just too expensive.
So what happens then when people have issues with their teeth? Do they go to the dentist because they just can't avoid it, or do they head to an emergency department?
Well, a lot of people suffer through the pain and embarrassment of bad dental health. A third of people have untreated dental decay, and a third of people are worried about how their teeth look. But even more concerningly, we do see record numbers of people turning up to hospital for severe problems with their teeth that could have been avoided if they'd had good access to dental care. So that's things like getting your teeth removed. So really bad outcomes, and those numbers have been going up. We're seeing more and more people heading to hospital for these largely preventable problems.
And what's access like for public dental health services then, Peter? What are waiting times like?
Oh, waiting times are really long, so they can be months or even years, and it's very different across different parts of Australia how much public dental care there is, but we do know there's clearly not nearly enough to make sure people can get the care they need.
And are there people who qualify for government money who are eligible, who may not know that they are, or who don't take up that cash?
Yes, that is happening. There is a scheme for disadvantaged children that the federal government runs, but only around 1 in 4 kids who are eligible for that funding are actually accessing it at the moment. And that's been a problem that's run for many years since that scheme was set up. So we've called for something much more ambitious, as have many other people down the years, which is really bringing dental into Medicare, making sure there's that meaningful government subsidy so that everyone can get the care they need. And with an election around the corner, we think it's a really good time to focus on that big and really overdue change to Australia's health system.
And why is that take-up so low then for those disadvantaged kids who are due that money?
Well, there's been a series of inquiries and reports saying that we have to look into it and work out what it is. Part of it might be lack of awareness. Part of it could be also cultural barriers, and the care is not accessible for some different groups. The rates are low for Indigenous Australians. They appear to be low for kids with disabilities. But it's also probably that this is a kind of band-aid scheme. It's a good idea to have support for these kids, but it's not that big universal system we want to build towards. And so it's not at the core of the business of the dentist. So some dentists choose to participate, they certainly don't have to, and in too many cases they aren't.
Even if you do have private healthcare, dental is still expensive, isn't it?
It really is. Even just a couple of years ago in 2022, a sort of standard visit where you get a checkup, some scaling, some fluoridation will set you back an average of well over $200, and in many places more than that. So with cost of living really on people's mind, I think this dental cost is a good one to look at, because it's not just the cost for the individual patient, which is really high, it's a big cost for the healthcare system. We've talked about people clogging up hospital beds that are needed for other kinds of care, and there's also good evidence that people will stay home from work, maybe be too embarrassed because of the way their teeth look to go to a job interview. So there are big costs for the broader economy as well.